Imagine that you've just reached retirement. You can't wait to spend more time with family and friends, hit the golf course, travel the world. But then your doctor diagnoses you with Parkinson's. Within a decade, you're having trouble swallowing, walking, and even speaking. This sounds scary, but it's not as uncommon as you might think. Between 1 to 2% of the population has Parkinson's, which is usually diagnosed at around age 60. And what's worse is that there's no known cure. But there is hope. Although there isn't a cure for Parkinson's, there are steps you can take to help manage and maybe even prevent some of its symptoms. Before I dive into this, be sure to share this video with anyone you think could benefit from it, because you might just change their life. I'm not a doctor. This is for entertainment purposes only. Before we look at some steps you can take to slow Parkinson's progress, let's take a look at how this disease manifests. There are 4 key warning signs that you might have Parkinson's disease. These are arrest tremor, rigidity, bradykinesia, and a loss of reflexes. Let's look at the first, arrest tremor. This warning sign is what people most often associate Parkinson's with. However, it doesn't always manifest how you might imagine. Arrest tremor is exactly what it sounds like. A tremor or shaking in a part of your body that's at rest. For instance, when sitting still, you might notice a tremor in your hand. But when you start doing dishes or typing on your computer, it goes away. Rest tremors can also affect other parts of your body like your legs and even your chin and lips. If you're experiencing this, it's definitely worth a trip to your doctor. However, rest assured that not every tremor means that you're developing Parkinson's. So the moral is, make sure to check out any tremor with your doctor. Okay, let's look at the second warning sign, rigidity. Rigidity is an extremely common sign found in 90 to 95% of those with Parkinson's. It's often referred to as having a mask-like face. While that might sound strange, all this means is that you have stiff or inflexible muscles. For instance, you may have a harder time making facial expressions like smiling or frowning, therefore having a mask-like face. Or you might have trouble getting out of bed or standing up from a chair. It might even cause you to be bent over when walking. Listen to neurologist Dr. John Brillman talk more about how this can show up as an early warning sign.
Most patients that develop early signs of Parkinson's disease don't notice any change in themselves or may regard it as just the normal aging process. But often a family member, usually a spouse, will say, "Why are you walking so bent over?"
Like Dr. Brillman says, you should know that rigidity due to Parkinson's isn't to be confused with general stiffness associated with the normal aging process. While 25% of adults suffer from joint pain and stiffness, a small fraction of these will have Parkinson's. Let's move on to sign number 3, bradykinesia. If you don't know what this word means, here's a quick etymology lesson for you. Brady, which you may have heard in words like bradycardia, means slowness. Kinesia, think kinetic, means movement. So bradykinesia means slowness of movement. If you have bradykinesia, you might find that you're dragging your feet when you're walking. The muscle reactions might become slower, and it might take you longer to stand up from a chair. Your rate of blinking may even slow down. According to research, bradykinesia is reported in a whopping 98% of Parkinson's patients. In other words, this warning sign is a hallmark trait of this disease. Let's look at the 4th warning sign, and then stick around to the end for some steps you can take to slow Parkinson's progression. Warning sign number 4 is loss of reflexes. This is another common sign of Parkinson's, and physicians often use a series of 3 tests to assess whether you have this. 1, they might test you to see whether you can stand up from a chair without using your arms for support. For many with Parkinson's, this causes difficulty and may even cause them to fall. Another test involves observing your ability to walk without assistance. If you're frequently tripping or have an unsteady gait, this might be a sign that you have a loss of reflexes. The third test involves what's known as the pull test. In this, the examiner stands directly behind the patient and pulls back on the shoulders to assess their response. In normal conditions, the patient is able to adjust their centre of balance without falling. In those with Parkinson's, however, their centre of balance is thrown and they may fall. Okay, as scary as these symptoms are, and I know they're scary, there are some lifestyle changes you can make to manage or even prevent some of these symptoms. One is exercise. Fortunately for you, doctors seem to be pretty much in agreement that exercise is hugely beneficial for Parkinson's patients. What type of exercise should you do? Well, every type. That's right, a combination of aerobic exercise, strength training, exercise to improve balance, like yoga or Tai Chi, and flexibility is considered one of the best ways to fight symptoms of Parkinson's. Why does exercise have a positive effect? Listen to PhD Daniel Korkos of Northwestern University Feinberg School of Medicine talk about his research on this.
People with Parkinson's disease are weak, so a combination of being weaker and having abnormal muscle activation patterns led me to propose a research study to look at the effect of resistance exercise. Progressive resistance exercise dramatically reduces the signs of Parkinson's disease. So people, as a result, they were stronger, they were faster, their muscle activation patterns improved, and they were very happy.
According to the Cleveland Clinic, the sooner you begin an exercise program after Parkinson's diagnosis, the better your disease outcome will be. How much exercise do you need to do? Well, the Parkinson's Outcomes Project says that in research, people who exercised a minimum of 2.5 hours per week early in their diagnosis saw a slower decline in quality of life than those who started exercising later into the diagnosis. Remember, 2.5 hours per week is only 25 minutes per day, 6 days a week. That's definitely doable for most of us. Okay, let's look at prevention number 2, coffee. This is great news for all of you caffeine lovers out there. You don't need to give up your beloved cup of coffee if you have Parkinson's. In fact, you should maybe drink more of it. While research is needed in this area, some studies have found that drinking coffee is associated with a lower risk of developing Parkinson's disease, and that it may even help those who are already diagnosed with it. A study published in the 2012 edition of the journal Neurology, for instance, looked at the effects of caffeine consumption on 61 people with Parkinson's. What they found was that after 6 weeks, those who consumed caffeine reported a 5-point improvement in Parkinson's severity rankings, plus a 3-point improvement in speed of movement and level of stiffness. However, it is yet to be seen whether these results are short-lived or long-lasting. Research in this area is still pretty new, so these findings shouldn't be taken to definitively indicate that caffeine consumption improves Parkinson's symptoms, but it does seem promising. On to the last prevention, good old-fashioned diet. If you've watched my other videos, you've heard me sing the praises of the Mediterranean diet as a secret weapon against many diseases, and Parkinson's is one of them. A study published by researchers from the Harvard T.H. Chan School of Public Health found that those who followed a Mediterranean diet were less likely to experience early symptoms of Parkinson's. And by less, I mean a lot less. After analysing data on over 47,000 participants, they found that the top 20% of healthy eaters were 1/3 less likely to develop early Parkinson's symptoms over the course of 20 years. If you're not yet familiar with the Mediterranean diet, it's pretty simple. There's no counting calories or counting carbs or complicated meal plans. The diet simply prioritises fruits, vegetables, fish, whole grains, legumes, and unsaturated fats like olive oil. Doesn't sound too bad, right? If you enjoyed this, please consider subscribing as we continue to make content to help you live longer, happier, healthier lives.